Hi, I'm Dr. Paul Kettle, and in this episode of Psychiatry in 5 Minutes, we're going to be going over psychodynamic psychotherapy. That is something which often people don't understand very well because it's been out for a long time, and so people go through what they saw in movies or what they think it may be, not what it is. Freud described this more than 100 years ago, but he described it over decades, and his ideas about this changed over time. So why don't we go over some ideas which are helpful. First of all, it's a topographical model, which is the idea that Freud developed that there was an unconscious, that there is a conscious set of thought, which is what's in your brain right now, preconscious, which is what you can bring to consciousness, and then unconscious, which is not conscious at all. So conscious may be listening to this lecture, preconscious may be, what I had for dinner was pretty good. You can remember what you had for dinner. But unconscious may be the desires or fears that you're guarding against. Now, Freud believed that there was only a certain amount of energy. Remember, this is pre-Einsteinian physics here, where conservation of energy was still a thing. That is, that you only have so much energy, and we use energy to keep the unconscious down, and that every now and then the unconscious ideas will bubble up, and we use defense mechanisms to keep them down, to guard ourselves, to guard our conscious, to guard our ego from these desires which may be too threatening. So anxiety comes when these things bubble up, and we use defense mechanisms to keep them down. Now, that is probably the most useful thought, that unconscious thoughts come up, and they come up again and again and again, and people are unaware of what it is. So psychodynamic psychotherapy may be best thought of as bringing to light unconscious thoughts, ideas, or drives that are bubbling around in someone's psyche that we're not aware of, that happen again and again and again. Often from the outside, it's fairly clear that this person has problems with relationships or problems with their own drive or their own self-doubt. And that is because you see it again and again throughout their history, but the patient themselves may not be, usually is not aware. So psychodynamic psychotherapy is the process of bringing the unconscious conscious, but it's done so carefully, meaning that patients are encouraged just to talk about whatever comes to mind, thinking that eventually, without guarding, that these things will bubble up and talk about it. In addition to that, the relationship between the patient and therapist is key. In a sense, the therapist and patient is a relationship lab. That is, that the patient is who they are and brings these conflicts to the therapist, which is a real gift in therapy. We call that transference, that they act towards the therapist the way they act. And it's a real gift because you're able to see right in front of you what the patient does and how that could be problematic. Usually in the very beginning of the relationship, like all relationships, people are on their best behavior. It's usually only after about 5 or 6 weeks that you begin to see the bubbling up of the transference and the conflicts that come therein, and it can be useful to talk about it. Now, other concepts like the ego, id, and superego are helpful to know. Ego is the boss of the situation. Id is where these conflicts that are bubbling up that you want to do. And ego is the no, don't do it, with the ego caught in the middle. And so you want to develop a observing ego of both the over-punitive superego and the over-demanding id of these impulses, which is, terms that are used. Freud also talked about psychosexual development, that people go through the oral stage where a baby's not able to distinguish between their own mouth and the mother's breast. In other words, can't determine what's real, what's not real, what's inside them, what's not. Anal phase, where they seek to gain control over processes in their body, and again, there are people who have trouble with control. Phallic stage, where we develop ideas that there are different sexes and relationships, with the sexual identity and sexual desires are important. Then latency and adulthood. Freud believed that the key parts of development were done with by age 5, which is of course not true, but He believed that if someone was stuck early in development, unable to tell from what's real and what were not real, people would be psychotic. And then if you had trouble with control or relationships, those were neurotic, and people could fall back into one. That is, could go from neurotic to psychotic, which isn't really true, but that's what Freud believed. But the idea of nervous breakdown comes from this idea. Now, Freud, remember, believed that development, or at least the important parts of development, were over by age 5. Erik Erikson carried his thoughts further and said that really development continues throughout the lifespan, and Erik Erikson's writings are useful and important things to go over. Also remember that there are defense mechanisms, and defense mechanisms are things that are used to keep the anxiety tampered down. When ideas from the unconscious bubble, we use defense mechanisms to keep that down, and identifying these defense mechanisms in therapy can be helpful. So psychodynamic psychotherapy is a way of having the unconscious become conscious. Freud believed that once these ideas were conscious, the energy you were using to keep them down could be used for productive pursuits. But what is probably more true is that if you're aware of the things that can drive your behavior, you can better run your behavior. And that is probably a more modern and better way of thinking of psychodynamic psychotherapy. Read more about it. If you're interested in Freud's ideas, introductory lectures on psychoanalysis, over 100 years old, still available. You can get it on Amazon, and I would recommend you read that. It's not all that long. Thank you for your attention. Read more about it.